sneezing, sniffing, that nagging cough. You just might see a lot more of that this flu season, and that flu vaccine may not work like it should. News 8's Bob Wilson live tonight in Hartford with some disappointing news for those who are battling the flu. So the vaccine's not working great, Bob?
Yeah, you know, they set the vaccine parameters based on what happens in the Southern Hemisphere in Australia. Australia had a brutal flu season. The vaccine didn't work that well. Now we have the vaccine and the flu coming our way. They're trying to adjust it, but brace yourself.
The experience in Australia was that the flu vaccine was not as effective as we would like this year, and there was a lot of influenza.
Dr. Joseph Garner with Hartford Healthcare says Australia just came out of winter and the flu season, and it was a nasty one because the vaccine wasn't as effective as they hoped it would be.
And they really generate our vaccine based on what's happening in the Southern Hemisphere. But during the next 6 months, things can change.
Dr. Gardner says even though the flu vaccine is still being adjusted to our version of the flu strain, it's still the best defense against the illness.
And you always hear doctors say, wash your hands, wash your hands, wash your hands. And that's good advice. There's something else you can do. The nickname for this? The petri dish. You're coughing, you're sneezing on it. Your kids, your family, they're sharing it, they're texting on it, they're putting it up to their mouth. A very easy way to spread the flu.
Be very careful in terms of touching things, then touching any of your mucous membranes, your lips, your eyes, your nose. You can transmit virus on your hands as well.
And keep in mind, if you are sick and have the symptoms, runny nose, cough, fever, you can give it to others through tiny water droplets in sneeze or touching or mucus.
You're contagious as you get symptoms and for several days thereafter, although it's tapering off.
And if you have a family full of the germs, keep your hands away from your face, wash your hands, and keep in mind that those germs can last on doorknobs, things like that on the phone for hours, even 24 hours plus in the right conditions. I'm Bob Wilson reporting live in the Hartford newsroom, News 8.